Thank you, Mr. President.
Mr. Moorhouse.
I'd like to ask the Minister for the Cabinet Office whether Public Health has developed any policy initiatives to tackle obesity levels on Ireland by promoting active lifestyle following the COVID-19 pandemic and increased concerns about obesity.
Minister for the Cabinet Office is the same person, Mr. Harmer. No? Who's the Minister for the Cabinet Office?
Mr. President?
Is it an MLC?
Maybe it should be.
Chief Minister.
Thank you. Question number 12.
Yes.
Question 12.
Right, yeah. Minister for the Cabinet Office. I presume there was... Yes, I see where you're coming from. My apologies. Yes, legally.
It's a new one on us.
That's me, isn't it? Thank you, Mr. President. The honourable member will be aware that concerns about obesity are long-standing, both on Ireland and indeed globally. As a major cause of preventable ill health and mortality, obesity is already overtaking smoking. With regards to COVID-19, obesity is now established as a risk factor for serious disease and poorer outcome from infection. The likelihood that COVID-19 will continue to circulate globally for some time adds additional impetus to the need to reduce obesity levels. Unfortunately, reducing obesity falls within the category of wicked problems due to the multiple factors that influence it and the social complexity of the interventions required. Physical activity is undoubtedly beneficial for a range of physical and mental health and well-being outcomes. Sadly, however, the evidence is clear that focusing on physical activity as a single intervention will not have any significant impact on weight at an individual level or on population levels of obesity. The short answer to the question is therefore that the Public Health Directorate has not and does not intend to develop any policy initiatives to tackle obesity simply by promoting an active lifestyle. Initiatives which support including physical activity in normal daily routines are well established as the best approach for increasing levels of activity across the population. This requires a range of interventions from environmental, making being active easier, through to behavioural, encouraging people to make the choice to be active. Simply promoting an active lifestyle in the sense of providing information about the benefits of activity in the hope that people will change their behaviour will not achieve changes in activity levels at population level. The Public Health Directorate will continue to work with all government departments to agree evidence-based and sustainable approaches to reducing obesity and increasing levels of physical activity. Thank you.
Supplementary, Mr. Moorhouse.
Thank you, Mr. President. Thank you, Chief Minister, for that rather complex answer. In terms of going forward, possibly the private sector could become more involved. The answer tended to focus on the way in which the public sector would come up with solutions. One interesting aspect of us coming out of lockdown was when the 25 Dreams came together to put forward a letter suggesting they were ready to reopen. Would that sort of forum be a possible way that public health could meet up with the private sector and develop some new initiatives? Thank you.
Chief Minister.
Thank you, Mr. President. I'm more than happy as the Minister for the Cabinet Office to speak to the Director of Public Health to take forward that useful suggestion. Clearly, it must be seen as having a real benefit to the nation and not purely for the benefit of that sector, but anything that can help the island tackle obesity has to be a good thing, and I've always said working with the private sector, the third sector, has to be a good way forward.
Honourable Member for Douglas Central, Mrs. Corlett.
Thank you, Mr. President. I'm sure that the Chief Minister would agree that we should harness and build on the positive changes that many people have made during the COVID-19 pandemic. But would he also agree that we need to look at our living environment as a whole and aim to make the healthy option the easiest option? If the healthy option is the most difficult or expensive option, it's then difficult to persuade people to make the right choices. So would he agree that the only way to reduce obesity is with a whole system approach? Thank you.
Chief Minister.
Thank you very much, Mr. President. I thank the Honourable Member for Mrs. Coulter for a very helpful question, because it clearly shows it's not just one area that you've got to work on with obesity. It's a holistic approach, if I use the phrase correctly, a multi-pronged attack. For example, our Manx Sport and Recreations Service deliver, I think, 98 exercise classes each week, but that in itself is not enough. And I think the answer I gave to the Honourable Member at the start of this debate is saying that the Public Health Directorate will continue to work with departments to agree evidence-based, which is our Public Health Director is very keen on evidence-based and sustainable approaches. But going back to the olive branch offered by the Honourable Member for Castletown and Malew, if there are third sector or private sector businesses that have the experience and feel that they can help the government in its aims, I'm sure they will be given a good listen to, and any advice, if it's evidence-based, will be accepted.
Honourable Member Mr. Shimmons.
Thank you very much. I'd like to ask the Minister for the Cabinet Office whether he agrees that active travel participation has been proven in many European countries as one of the most effective ways to tackle obesity, and also, of course, it offers economic benefits to the individual in terms of reducing their daily costs. Given what we now know about COVID-19 as this being a risk factor, is it time to accelerate and really get some traction on our active travel policies? Thank you.
Minister.
Thank you, Mr. President. I thank the Honourable Member for Middle for his question, because a number of good things have come out of this terrible situation of COVID-19. I think people working from home, the teams, less congestion, less fumes in our roads as a result, and it's certainly great to be able to get into the office quicker as a result of that for those that do come into Douglas. And seeing people out exercising more, I know the number of people walking has been considerably more and has continued to stay after the breakdown. So that has to be something that we do look at and try and ensure that we don't slip back to our old ways, whether that's cross-government departmental working, to encouraging our public to get out and cycle, walk and experience the beautiful Manx countryside. It's something personally I've been very supportive of as a backbencher in the Department of Infrastructure. I held out for the resurfacing of Peel Road on the condition that the hardcore taken up was used on the railway track from a well-known constituency to Crosby to enable people to get out and walk. And I was delighted when I saw a family there with a disabled child in a wheelchair able to get out with the family, because we had provided improved facilities. And I'm delighted that the Minister for DIY is looking at, is actively working on the heritage trail along the railway line, and I look forward to the day of being able to walk from Peel to Ramsey. Thank you.
Final supplementary, Miss August Hanson.
Thank you, Mr. President. Just asking the Minister for the Cabinet Office whether or not he will be working with or encouraging the Infrastructure Minister in, although he is re-evaluating the governance of the active travel, those meetings. I mean, whether or not he will encourage him to restart them. Thank you, Mr. President.
Chief Minister.
Thank you, Mr. President. Yeah, I think it's clear from the conversations that we're having this afternoon, Mr. President, that this is a cross-departmental problem. It's not simply a Department of Health and Social Care issue where we come up with a diet for people. It's a cross-departmental with the Department of Infrastructure to work together with Education, Sport and Culture and Health and Social Care and any other department where there's relevance to help take this forward. And I think, I really hope that where we have excelled of recent during the COVID-19 situation is, I'm not saying ripping up the rule book, but departments just working together and getting on with it to deliver a strategy, and obviously the Cabinet Office, with public health being there, will be a part of that, and I will be asking the political members of the Cabinet Office to, at the next departmental meeting, to help work this strategy up of cross-departmental working on this very topic. Thank you.